Hi everyone, and welcome back to another Aligning Authenticity episode where we discuss all things mental health. I'm Alia, and here we have Lavender with us today, who is a clinical psychologist. So tell us a little bit more about yourself, Lavender.
Thanks for having me. My name is Lavender. I am a clinical psychologist. I've been practicing in Malaysia for the past 7 years.
Yeah.
I predominantly work with teenagers and adults with a range of mental health difficulties, but issues like ADHD, autism, anxiety, depression, OCD, and I also do a lot of mental health training. So fun workshops just to get everybody talking about mental health and learn like little coping skills here and there.
Right, great. Yeah, so I think there's so many different things that we can talk about, but for today's episode in particular, we're going to focus a little bit more on ADHD. Okay, so there are also quite a lot of people out there who are not aware of what are the differences between a clinical psychologist and a counselor or even a psychiatrist. So just to make it clear is where psychiatrists, they focus more on the meds, like dispensing the meds and also diagnosing certain conditions. Tell us more what a clinical psychologist does.
Okay. So for a clinical psychologist, a big part of our training is actually in what we call assessments, right? So these are tests that are created according to standards with really, really big samples.
Yes.
So when we say, for example, like, oh, you have clinical anxiety, how do we know it's clinical versus it's everybody has anxiety, right? If you don't feel anxiety, it'd be really weird, right?
Yeah.
So this is based on taking a huge sample, creating the norms, and then seeing how high the levels of anxiety are for it to warrant diagnosis.
Yeah.
So that is a big part of what clinical psychologists do.
Whereas for counselors is where we focus more on the therapy side of things. Yeah, so whether it's talk therapy or so, and then so let's say we have a certain a client with a certain issue, and we feel like okay, maybe you want to explore it a little bit more. That's why we will also channel you towards the clinical psychologist or even the psychiatrist. But for the clinical psychologist, you guys, they can also do therapy. Right?
We do. Yeah.
So that's why she does therapy too, aside from just assessments. Okay. Yeah. So, but just to make it clear today, we're not here to actually share, for example, what meds you should take if it's ADHD. But what I've also wanted to do with this episode is where, because we have had quite a few different letters that come in or questions basically on ADHD and how that journey can be like. So Lavender, I'm hoping also that we can discuss that a little bit more because as she mentioned, she has a lot of clients that have ADHD or autism, and we can talk about what is that personal journey going through it. So I'm just going to read out the letter first. Okay, so we have a letter for letters to Alia from Ruzz, who's feeling overwhelmed. Okay, so she was diagnosed with ADHD recently, and she's scared to take meds because she doesn't know what the side effects could be. And because she has kids, that's where she feels like it might be the best thing to do because she feels that her mental health hasn't been 100%.
And there's so much to deal with, right? So much to deal with when you have kids.
Yeah. So, and she hasn't been very present, and she feels that it's noticeable to the kids. So she's wondering what we think, what are the side effects, and are there any other ways of managing this without medication? Yeah. So, any initial thoughts about it? Because for this one, it kind of sounds like it's a bit later on in life.
That she was diagnosed.
Yeah,
she's diagnosed recently.
Yeah.
Is it clear that it's after she had kids that she was diagnosed?
I believe so. It is not super clear here, but I would say maybe, when you say recently, it could be
as an adult,
a few months. Yeah, as an adult. Yeah.
Okay. So that can be a real struggle. I think the thing is with late diagnosis of ADHD, there is a huge buildup of self-esteem issues, right? Because you spend your whole life having these struggles. We call them executive dysfunction, which is where you have struggles with like planning, with organizing your thoughts, with remembering tiny details, with focusing on things and like being able to multitask. All of these things are super necessary when you're a mother. So potentially when she's at this stage of her life, it's that she has been managing her ADHD all this while. but with compensatory behaviors, but the added responsibility of being a mother just pushed her over the edge, right? Like just made it so much more overwhelming.
Yeah.
So it's understandable.
Yeah. So as I understand from ADHD, it's where the effect can also be, or how it manifests, basically, it could look different in men compared to women. You know, so I think that there are like two things for us to kind of look at there. So one is like, what is the difference if you are diagnosed maybe a bit earlier in life compared to later on? And second is, how does that look like for a woman? Like when you said just now, you kind of get tipped over the edge, right? What are some of the emotions maybe that might come with that? So maybe we could first talk about what's the difference if you're diagnosed earlier or later, let's say.
There's huge differences. I think predominantly the difference is, like I mentioned, on self-esteem and how you feel about yourself, right?
Okay.
The earlier you're diagnosed, the earlier you are taught, hey, this is just how your brain works and how we can adjust to it. And then the people around you also understand that, hey, this person needs this kind of support. So you get support earlier, you get acknowledgement earlier.
Yeah.
The later that you are diagnosed, the more likely you are to be criticized for the things that you struggle with.
Right.
Right? So the more you will beat yourself up. And the thing is with mothers who are already hard on themselves. So imagine being like so hard on yourself and you still also beat yourself up for these things that are more related to the way that your brain functions.
Yeah. Yeah.
So it can be really, really tough.
So it's where you feel slightly more out of place then, would you
I think
say?
significantly more.
Yeah.
Significantly more out of place. So a lot of the clients that I work with who are late diagnosed, actually a lot of the work we do is on understanding, yes, the ADHD, but also self-compassion. Yeah.
But would you say that the maybe some of the symptoms of ADHD, right, it can also look different for different women?
Yes, for sure.
What has been like maybe some of the more common ones that you've seen in your clients?
Okay, so the more common ones with women are the inattentive type of ADHD.
Okay.
So they may not be like running around, or they may not be talking very fast. They could be talking a lot or talking very fast.
Yeah.
But a lot of it is like more discrete, like forgetfulness, you know, having what we call time blindness. So sometimes you think like, oh, okay, if you're not always late, it means that you don't have ADHD. That's not true.
Okay.
I don't know if you have those friends who are sitting there for an hour waiting for everyone else because they cannot estimate in their head how much time it actually takes, and then they get very anxious. So they're, I just have to be early. So they end up waiting there for an hour before, right? On like standby mode. So some of those symptoms, and then things like not being able to multitask is a really hard one. There's so much expectation on women to multitask.
Yes,
right.
When you're juggling a few different things.
So for Ruzz, when she has a child, I'm sure there's so many things she needs to think about with her child. Maybe that will cause her to let something slide a bit at work by accident, and then she might get some negative feedback from there. Things like that can really overwhelm her.
Yeah, I mean the general golden rule with like, okay, when you should kind of explore getting diagnosed or so is when it starts to affect your functioning. So at least from what you shared about how, okay, maybe you start to see certain or you start to receive certain feedback at work, you start to not be able to juggle these different things, then I mean, that's when you should get diagnosed.
So one of it is functioning, yes. Another one is distress. So I think one thing we have to remember with women is also we are socially conditioned to hide our struggles, right? So if we only go by functioning, a lot of women can go very, very far without anybody else noticing what they're struggling with, right? So they'll stay up really late just to compensate and make up for all of these things that they missed out on during the day. So I would say distress is another one you want to look at. How much you are struggling. Even if other people don't notice, if you feel this overwhelmed, that's where you want to
because that's also like, I mean, linking back to what we talked about just now, or the question that I was asking, because it's a very big difference between men and women. Because for men, like I say, when they are much younger, and this is also one of the things that they say, that it's much more noticeable because for them it comes out more in terms of their behavior, right? Like maybe they can't sit down in class, or they can't keep
Like
still.
run around, very naughty, right?
It's very like physical, you know. Whereas for women, as you said, because there's that adjustment, it doesn't always come out as physically, but it comes out. And from what I've seen with some of the clients or so, is where it's a very deep emotional overwhelm, I would say. But would you say that that's been also the case, like when you see with your clients?
Yeah. People with ADHD have a higher risk of other mental health difficulties, especially anxiety, but also depression.
Yeah, and maybe for women, but I'm not too sure. It's just what I've read. But I also wanted to know, based on your experience, is it where it also has to do with the hormones for women, because we are already naturally on our own roller coaster, right? Every month. Do you think that that's heightened when you have ADHD?
Based on your cycle? I don't know which way it goes, but with a lot of my clients, your hormonal cycle does affect any mental health difficulties. So with ADHD, a lot of my clients who have ADHD will find that certain periods of their cycle, they will be even more scattered, more likely to be anxious. So it heightens the symptoms of their mental health difficulties. And it's the same with people with anxiety, depression.
All right, so amplifies it a bit more.
It does.
Okay.
It does. And it's every month. It's every month, so it feels pretty frequent.
Yeah, no, for sure. Yeah, so I guess, okay, so coming back to Ruzz also is where, so now she's also, one is where it's diagnosed a bit later on. So it's completely understandable, Ruzz, for you to have these different emotions about it and these concerns, you know. What can help them cope, right, with it? Or at least at the start, when do you know that, okay, like, there's something more that I have to do about the situation, you feel?
Okay. So there's a lot of things that can be done to help you cope. And you mentioned medication, right?
Yeah.
Should I go into that?
Yes. Yeah, we can talk about the medication, because some people, they may prefer to not go for medication first, and then some might prefer to take that route. So I just want to know, like, what are the differences, you know, between the two that you've seen?
It's very, very personal, because everybody has their own attitudes and beliefs about medication. So it is really, really up to you. But what I do want to say is that we really don't want to villainize medication. There's so much stigma against it. And there's this belief that, oh, if you take meds, you are weak, or you're using it as a crutch. That is definitely not true. You want to weigh out the cost versus the benefit.
Okay.
Right?
Yeah.
So even when it comes to side effects, the side effects that are commonly reported by my clients are things like low appetite when they're on the medication, sometimes headaches or fatigue, but it doesn't always last. It really depends on the individual body. So I do have clients who start medication and their focus improves so much and they have zero side effects.
Okay.
They feel nothing. I have clients who only feel the side effects towards the end of the day. So with ADHD meds, typically it's a 12-hour efficacy, so it works for the day. So you want to give it a shot if you feel like it can really help you, right? If you feel like you're struggling so much, stop torturing yourself. Give it a shot if it can help you, right? And for a lot of my clients, what happens is when they're going through this really hard time and they need that extra boost from the medication just to get them started on building the right routines and habits that will help their ADHD, they start off, taking it every day. And then after a while, once they have their life in a sort of system that works for them, which is the second part, right? Aside from medication, we do work on things like creating systems, habits, self-compassion, how to practice self-care. Once those things are aligned, then they actually start to reduce their use of the medication. So I have clients who, for example, only use it on weekdays. Okay. Right? Because they need to go to work and take care of their kid.
Oh, that's interesting.
Yeah. I have clients who only use it in certain periods of their lives. For example, exams or a big presentation.
Yeah.
So it's not like, oh, you start, you have to use it forever. It's not like a life
sentence.
Yes, it's not a life sentence.
Right.
You just need to find a good psychiatrist that you can work with.
I always kind of thought that it's where, okay, if you start taking meds, it takes a while for your body to get used to it. And then as you go along, that's where your dosage might actually get adjusted depending on like what you said. But I never knew that with ADHD, it's where you can take it during some times which you're struggling a little bit more, and at other times you can decide to not take it, you know?
I don't know the science behind it. This is why I observe in my clients, and they all go to psychiatrists. So they have somebody guiding them.
Yeah.
Typically at the beginning, yes,
Okay.
they do need to take it regularly for their body to get used to it.
Right.
But after that,
Okay.
so you want to do it with the support of a good
Yeah.
psychiatrist.
And there's also the case of where, I mean, at least for some, like I know some centers where they do case management,
Yes.
right? Where the clinical psychologist works with the psychiatrist, and also if need be, there's also a counselor there. Also, yeah. So, but this is not something which a lot of people are actually familiar with. They think that, okay, I just go to the psychiatrist, I get the meds, and then and for some of them, I think it's where they don't even highlight when they feel that their body is not reacting as well to the meds. But have you seen that in your experience?
There are certain clients who will not want to go back. I think we're Asian, they're like, oh, this doesn't work, I just don't want to go back. They don't want to go and tell the psychiatrist that this didn't work or this, gave me reactions. I usually try to encourage them to go back, and I try to explore why you don't want to go back. So that's why it's very important to find a like with all medical professionals, someone you feel comfortable with, right?
Yes.
So if they don't feel comfortable talking to that psychiatrist, I'll usually find them another one.
Yeah. And the other thing that happens with that is where some of them just decide to just go off the meds completely.
Yes. Yeah. Doesn't work.
Doesn't work.
And the thing you said about like how you need to take it consistently for it to work, that is very typical for antidepressants and anti-anxiety medications.
Okay.
Those you need to keep it consistent. You can't eventually use it.
So it's slightly different for
slightly
ADHD
different.
then?
Yeah.
Okay. Yes, we're not here to villainize, to tell you which one is right or wrong. We just want you to be aware of what are some of the different things that you can run into, right? So in that sense, what have you noticed as the difference between those who, okay, I decide to take this journey without meds compared to with meds?
Okay, so the stories I'm going to tell, I'm going to mix them up and like anonymize them, so it's
of
never
course,
going
yes,
to be
yeah.
one specific person.
Yeah.
Okay, so I think the difference actually, it's really hard to compare because people come from different points in their lives.
Yep.
Right? So there are clients who, for example, they have ADHD, late diagnosed, only when they come to me with depression usually, or anxiety or something else. And then I realized there's also a lot of symptoms from your youth that shows that there's signs of ADHD, right? So this person is already downtrodden, and there's a lot of things that are not going well in their lives, and they're so weighed down by not being able to cope. And then they take medication, and the medication is that extra boost that they need. If you're so low, you need a little bit of a boost to get you here. And then in therapy, we work very actively in terms of creating systems, new ways to manage things. And then after a while, they can start to ease off or just do weekdays.
Yeah.
So that helps a lot. There are some who maybe they're not down there.
Yeah.
It's more like they have some coping skills. They've managed most of their lives, but they need more. That's when we mostly just focus on coping skills. It's up to them.
Yeah.
I do share with them, if you want to try medication, you can as well. I can help you find a psychiatrist. But sometimes they don't want to. They just want to, and it's okay. Like either way, you can create systems. It's just you want to see your starting point lah. Right? Like when you are at whatever point you're at now, does it feel like you're really, really low and you need that boost?
Okay. Right. So one is just, okay, so from what you shared is where one is the stage of life that you're at.
Like something happened. You've got enough to deal with, stop torturing yourself.
No, it's the same, right? Sometimes okay, like let's say if you have a fever, then you can choose. Do you want to take Panadol and have it go away in a short while, or do you want to do the natural way,
remedies
and
that
then
will
just
take a while.
Yeah,
Depends, right, on how quickly you need to get to work.
Yeah, in some cases,
If it's
yes.
like, oh, okay, today is Friday, I'll just take the remedies and see if I'm better by Monday. If it's Sunday night, you take the Panadol.
Probably, yeah. I think that's an excellent analogy. Yeah, nobody goes for therapy or to check out of nowhere. You know,
Yes.
there must be some catalyst kind of event that happened. But even for professionals, right? I would say, like, whether it's the clinical psychologist or even a counselor, would you say that, okay, like for you to see that there were certain childhood patterns, doesn't it take them coming for a few sessions first before you see like, there's something there, you know?
Well, I think the intake process is very important.
Okay.
It might take a few sessions to be sure. So certain clients are like, I catch a hint of it, but I'm not sure.
Yeah.
But in the intake, so the first session that a person comes in is usually the longer session. I already start asking what things were like for you in childhood.
Yeah.
You know, what was
Yeah.
it like for you in kindergarten? So you already start to see signs. And some of it can be quite obvious. Yeah, and a lot of times there will be things like, oh yeah, you know, my principal complained to my parents saying like, oh, I think you should get her tested, you know, or so those are principals who know, right?
Yeah,
They'll be like,
yeah.
I think she has something. Or they're just saying, oh, it's so naughty, so naughty.
So naughty. Okay.
Yeah, so you hear these things when you ask for early signs.
Yeah. Interesting, because I've heard that also for women, there are still some women out there who might have performed well in childhood or so, like in terms of academics and stuff, but then they find that as they're older, like you said, when motherhood hits or so, that's when it pops up more. So how do you then detect that? Because when it comes to that earlier stage, they will probably be like, yeah, nobody really complained, right? Like I did fine. But have you seen that in your experience?
So academics is only one thing, right? So aside from just saying how did you do in school in terms of academics, like how did you get along with friends? Did your mom tell any stories about you when you were young? So even if they do well academically, there'll be stories like, yeah, you know, my mom always says, if your head is not attached to your body, you will lose it. Have you heard that?
Yes. Now should I be concerned? I heard that a couple of times.
Yeah, you know, this kind of things. Have to like label all their stuff because it all goes missing.
Okay.
The Tupperware, you know, moms go crazy about the Tupperware, right?
Yeah. But what else? Like, I mean, let's say even in terms of your interactions with other people also.
So if it's the hyperactivity type, they might say like, yeah, my mom says that I talk too much, right? I will talk to anyone, go restaurants, simply talk to people. Or like, oh, this kid can't shut up.
Okay. Wow. All right. Okay.
So there are some early signs of the, in order to diagnose ADHD is a neurodevelopmental disorder.
Yeah.
There has to be symptoms before 12. If it's after 12, it could be something else. Like trauma can affect your attention span.
Yeah. Okay, that's also very interesting. There are also people out there who they feel like, okay, I just went once and they said it was fine, or I didn't really get that much out of the session, right? Like what would you say to that though, you know, in your experience? Because it does take time, right, to diagnose it.
Everybody has a right to not go for further treatment if they don't want to or if they don't feel comfortable. But if you feel like this is a pressing issue but that one time wasn't helpful, find somebody else. The therapeutic relationship is very personal.
Yeah.
So if you feel like therapy wasn't helpful one time, it doesn't mean that it won't be helpful with a different person.
Yeah. I mean, it's a very big thing. I think the two things that you've mentioned about how your free choice is very, very important, right? Because therapy or any form of assessment is not effective if you yourself don't really feel like you want to do it, you know? So I guess for some, right, then maybe the next question that comes in is like, what qualifies that this is really something that I need to take action on? You know, because like we talk about, okay, it affects functioning or so, but we understand it better as professionals, right? But how about for people out there who they're like, am I really at that point that I need to do something about this? You know, like for example, for Ruzz, it's like she feels it's noticeable for her kids.
Yeah.
And then, you know, her concerns about the side effects of the medication, but like, how would you guide that also if that was the client that you're working with?
Okay. Well, if she's really concerned about medication, I would actually suggest, I would sit with her to understand her concerns. And we can do some research together, but at the same time, I work with where the client is at. Some people have very strong beliefs about medication, and sometimes these are solid reasons. There are people who have reactions to just Panadol. Some bodies take chemicals,
Yes.
So very valid. Or maybe she's breastfeeding, then you want to be careful too. In which case, we'll work with whatever system she has and whatever support that she has. I think counselors do that a lot as well, right?
Yes, we do.
You get the partners in.
And sometimes it's also trial and error, right? You'd be like, okay, let's try this out. And then they're like, oh no, it doesn't work for me. All right, back to the drawing board. Let's look at what else works, right?
Or usually it's a combination of things, right? So we want to look at everything on your plate and how to adjust this until eventually you get to a point where you're like, okay, I'm not drowning.
Yeah. We are out of that danger zone. Yes, for sure. Yeah. Let's say, okay, you have no side effects or and there's other things that happen with it, then the route taking meds seems like the easier route. Like at least to pull you out of the danger zone, right?
Especially if we need that you're boost. In a really rough place.
If you need that boost. So let's say you're not on meds, also, then what are some of the coping styles, coping mechanisms that you've seen that can help with this, or to help with all these different symptoms, you think?
Okay. So I think to start off with, so it's called attention deficit hyperactive disorder, right? But actually it's not an attention deficit, is an attention dysregulation. It's not that you have no attention. You just don't have maybe as much control over it as a neurotypical person.
Because, sorry to cut you there, but because I know that I was also very surprised, and this was something that I discussed with previous guests who has ADHD, right? Is that you also have hyper-focus.
Yes.
Did you know that? You can hyper-focus.
It's just no focus. It's not no focus.
It's either full-on, like, really deep focus, or it seems a bit scattered. But so like you said, I love the way you put it. It's more of a
attention dysregulation.
Yes, you can't have a full handle on it, right?
So the two paths that I usually take first is to reduce cognitive load.
Okay.
The more you have on your plate, the more, like, you already have a hard time regulating your attention, right? Then you have like a million things to do. It's not going to work out well, right? You know, like how like Steve Jobs wears that one outfit every day, so he doesn't have to think about it. That is the concept, right? So you want to help
less
the client.
things to think about. Yes.
You want to help the client, and like you can't get the family members involved. How can we help this person reduce the number of things she needs to think about? I mean, it depends on the family, right? Many different ways to do this, like maybe like meal orders or like. You have a set menu of things. Everyone wears the same thing every day of the week.
And I think the guilt also is a very big part of that.
That's the problem, right? You don't allow yourself to reduce the cognitive load because you feel like, no, my child should have, I don't know, more outfits. My child should have a big birthday party. But when you're in this state, you need to reduce your cognitive load now.
Okay, so that's one of it. Then what are some of the other things you've seen?
Then the second thing is to work with your body and your cycle. I know this is easier said than done because sometimes maybe your work structure makes it hard. But one thing we do is we actually have like a log. So you start with a log and then you log your energy levels, your attention capabilities, different times of the day and week. And you start to see a pattern, right? Like maybe you're a morning person, an afternoon person. So it's never 100%, but you slowly start to shift your schedule to fit what works best for your brain.
Kind of like energy management. You know, there are like so many apps out there nowadays that you can just track it. So, but this is the beauty because this is also what I highlight a lot to clients that because some of them might feel like, oh my gosh, it's too much effort for me to start this or so, but having that information can really help you because your cycle is yours, your patterns, all that is yours. It's very different.
And the world kind of functions on the male's hormonal cycle too. You know, like males, they have a 24-hour cycle, right? So their energy peaks in the first half of the day, and then it dips in the bottom half of the day. So our work schedule is always you wake up, you go to work, and then at night you, right? Women are not like that. Ours is a monthly cycle. Right? So, I mean, you don't have full control, but you can see that ADHD menstruation tends to be worse during your luteal period, before your period. Right? That week, you maybe try not to schedule so many big events.
And I think it's also about the stories that we tell ourselves, because sometimes when you're not able to like consistently go 100%, like you said, because maybe there's the time that there's slightly more of that dip in the energy or so, but then what we do sometimes as women, I was like, but I should be able to, right? I must, like, I was okay last week, so this week I'm not okay, right? Like, I should just be able to continue with it. And then but it's not really very practical, because it's like even like a car, maybe you've got less petrol, right? And you're just like, but I should be able to make this certain number of kilometers. It's like it's
not
just,
the same. It's not the same.
A lot of people, they struggle with that, I think. Like, as in I personally do sometimes, like I think to myself, I should be able to do this or so. So what would you say to what are some of the ways that you find that has helped some people deal with that, like deal with the kind of stories that we tell ourselves, right?
Actually, it's a very simple technique, but it's very effective. It's actually to track what you do. So maybe you have like a monthly spread, and then maybe the things that you care about, like I don't know podcast episodes for you. Right? So then you track, this date you did how many hours of recording, how many hours of editing. You just put it in a calendar. So the weeks where you feel really low and you really cannot do that much work, most commonly will be like, I'm so unproductive and stuff like that. If you look at your calendar, you see, oh my God, you'll have your hyper-focus weeks. Look at how many hours I banged out the past 3 weeks. I can chill.
They call it momentum log sometimes.
Actually, I didn't know that.
Because in our society, it's also where we focus so much on the wins. Like, if I did this, it's a win. It's very results focused or outcome focused, right? So it was very interesting that I saw that they also have what you call a momentum log, because it's then looking at the amount of effort that you're putting in, not just the results of it. That can actually really help.
Just finding ways to give yourself the reassurance that your mind needs.
That's true. What else would you say to kind of like, let's say, maybe help Ruzz with that situation, right? Like the fact that she feels that her children might also be more noticeable to them.
Working on some level of mindfulness could be helpful. Maybe because she's so overwhelmed, she has so many things to think about. When her kids are there, it's hard for her to be present, right? So if she can reduce her cognitive load, not worry so much about certain things, let go of certain things, find the times when it's best for her, and then carve out specific times to really be present with her kids. So if she doesn't have a lot of energy, sometimes even just 30 minutes of full attention, like this is our playtime, they respond really well to that. The quality of that time. Quality over quantity lah. Maybe that'll be a good way to focus.
And what about in terms of reaching out for support? Because let's say for some of them, you have all these 1,001 things to do. And then, so we try to decrease that. Right? We decrease the things that we need to work on. But you might still need help in terms of with some of those other things, right?
It takes a village, right?
It does.
It does. And sometimes, right, like I do have women coming in with these difficulties, and they usually say things like, it's me, it's my ADHD, I cannot cope. But when you go down into it, girl, you're doing everything. This makes no sense. What's your husband doing?
Sometimes you got ADHD, don't have ADHD, also same thing, right? As in, the stuff that you have to handle.
And you see there's a lot of discrepancy, and I mean, I think in the past, this is very gender specific, but recently I'm starting to see even the flip as well. So even men who, internalize everything and actually they're doing everything. So you want to be able to reach out for help. You want to maybe have more discussions about more equal workloads within a household. Right?
So when
That's a tough one.
Yeah, it is a tough one. I think that was it can be a very long, ongoing discussion. But I guess the first part of it, because like one is about the conditioning that we have. So sometimes there can also be that part of us which feels like, all right, yeah, it's so nice. You can bang on to me about how I need to have these conversations or so, but we also learn in our fields that we still want to do it in a way which is culturally maybe appropriate, or fits the context, because we can't do things completely, let's say, the Western way, right? Because they're a bit more individualistic in that sense. Whereas for us, we have all these different nuances, right? So what has that looked like for you? I've had my own experiences with my clients, but I'm curious for you what that has looked like.
I don't really see how asking for help is individualistic. To me, that is the definition of a collectivistic culture, right? That we lean on each other and we ask each other for help, right?
Yeah.
So I think with a lot of my clients, I think the starting point is to allow themselves, right? There's actually a social research experiment where they had strangers and actors. So the actors like pretend to drop things, and then the strangers have to help them.
Okay.
Right?
Yeah.
And then there are situations where they just stand there and there's nobody drops anything.
Yeah.
And what they found is that the strangers, they will rate the actor as more likable if they help them.
Okay.
So we are social creatures. When you help somebody, somehow, for some reason, you like them more. So actually, in our relationships, if you allow the people who love you to give you some help, it actually strengthens your bond. They feel good. So the thing is, you just don't want to do it in a way that is hostile, right? You don't want to hold it in. And then when you get overwhelmed, you're like, yeah, I see you never help me. Then it becomes so aggressive, right? You want to do it in a gentler manner. So for example, like, oh, babe, in the morning, with my ADHD, I'm so blurry in the morning. Can you pretty please help me do this, like not too much lah, reasonable lah, like, a couple of things in the morning. It'll be such a help, and you really show gratitude. So there are nice ways to do it, not aggressive ways.
With the Ruzz situation, we don't know how her relationship is with her partner or so. But with kids, like,
that's a lot to do.
That's a lot to do. Maybe it's also worth sometimes spreading the cognitive load to them. To help with some small things, right? Like, for example, if you're doing 99% of the housework, it could help to get them slightly more involved to help you reduce that cognitive load.
So it can just be like, okay, sometimes they come into sessions as well. So we just do like a list down everything that you do or that you have to think about in the home, and then they will see lah.
Okay.
Right? And then we'll talk about like, okay, maybe the other person has a heavier job, for example. Okay, of course, we don't expect it to be 50-50 with everything. Is there anything you would like to take off her plate?
Yeah.
So give them that option as well.
Yeah.
And take off the plate means really take off her plate, not like have to remind.
Not have to remind one. And then second, I think it's also where sometimes, especially if you have been very used to doing it, that certain thing, right, is that we have our own standards as to how that's done. So sometimes, especially at the start, when it falls short of that, like it's not really performed exactly to how you want it, it's very, very challenging lah. But it's also really to remind ourselves in that moment, like, look, it's their first time. I've done it myself maybe like 100 times, so to give
They'll
that space.
get to it.
I think that's also very important. Or at least when we're talking about people being misdiagnosed, or let's say diagnosed later on in life, right? What are some other things that you've noticed about it, aside from the self-esteem issues?
It also does affect their overall functioning. And interestingly, there's also quite a heavy genetic component to ADHD.
Okay.
So it is very often I see clients who have ADHD who also has a parent who has ADHD. So it becomes sort of normalized that things are so chaotic and so messy and so stressful. So a lot of these systems are not in place.
But what does that look like though? I mean, aside from possible disorganization, things scattered, right?
It's not
What
just
have you
physical
noticed?
things, it's also
Yeah.
things like schedules.
Okay.
Schedules are scattered, so they grow up like so I know certain kids have very rigid schedules. They come back this time to this time, do homework and all that.
Yeah.
But some kids have crazy schedules where they don't even know which country they're going to be in the next week.
Okay.
The
all right.
impulsivity,
Right. Yeah.
Also financial messiness, because managing finances requires a lot of executive functions.
Right. Okay.
It impacts a lot health management.
Okay.
Right? If somebody has a chronic illness like diabetes, things like making sure you take your medication on time, having the discipline to go for walks. So really every area of your life actually.
Yeah. But what about the relational functioning? That means like how you interact with other people. Is there any big signs that you've noticed of that?
Relational functioning, yes. I think earlier on maybe the impulsivity is a big one. Sometimes saying things that you probably should keep inside. That can be
Okay.
that can be a common problem. Some of my clients with ADHD do say that they struggle a little bit with certain aspects of monogamy. Not that monogamy has to be for everyone, but there's that whole like, ooh, shiny new thing.
Oh.
Yeah. And then of course, as you build a life together, that can be very hard. Having a partner with ADHD can be a struggle. They'll forget things that you tell them, right? They'll be disoriented. They're working for 10 hours straight and don't listen to you. So it can really impact the relationship, because the partner, especially if the partner knows nothing about neurodivergence, might think that you just don't care enough. That's why you don't plan dates, or you're just not listening to me.
Yeah.
So that can happen too.
Yeah.
Are these things that you observe in your practice? Like, what do you see?
Well, for one, what I've noticed is that those definitely the self-awareness and acceptance is important, because I've seen so many of my clients where they have a sense that it is, or maybe they know that it is, right? But they are not ready to come to terms with that fact.
Okay.
But that is also not just for ADHD. That's across a lot of different things. Like, they feel that if I accept this, it means that I am more of a broken individual or so, right? Whereas there's a very big difference with the ones that have accepted that it is, because I feel that those who have accepted, they don't view it as like, oh, this means that I'm less of a human being, but neither do they use it as a crutch. I think that's the most important one. Because when you're owning that narrative, you have a lot more capacity, I would say, to deal with it, because it's not something that's like hovering over you and like you're so scared of, right? Like that you just don't want to look at it. Yeah.
Like, no, it's not that.
Yeah. Or something like, oh, boogeyman. No. I just don't want to look at this, right? Because it makes it real if I accept it. But those who like, oh, okay, I see this, this is what I go through, they're much more able to cope. Like whether they have decided to take meds or not take meds.
Yeah.
But I think that part of having that peace is very, very important.
True.
But in terms of how they relate to other people, I suppose what has been consistent across all that I see is that sometimes we chatting for a long time with them, or my clients, they'll be chatting and then suddenly they just disappear off the radar, like or a bit like you said, the time blindness, like maybe in their mind they've not seen you for a very, very long time, and you're like, okay, look, it was just very, very recent, right? It's not just the disorganization part, I've noticed.
Like, time blindness is a real pain.
And one other side one that I've noticed is the burnout. Like, especially when they're hyper focused, like what you mentioned about the 10 hours, they can go straight, like doing it. But after that, it's like
They get sick even sometimes.
Completely depleted.
They call it the neurodivergent burnout.
So what have you found has helped with that? Because like you said, they could be easily distracted by something shiny, and then they're like, all right, I go full steam with it. What can kind of help in those situations to reduce this neurodivergent burnout? From what you've seen,
that is a tough one. I think first of all, like you mentioned that boogeyman, right? So the thing is, if you don't accept that you have this, you might be more likely to push yourself. So what actually keeps them going is that what they say is, "Ooh, now I have attention. Like I can focus, so I have to like milk it. You know, it will never come again."
Yes. Okay, do now. Strike while the iron is hot.
That's why. And that's why they burn themselves out. But if you have this awareness, like, hey, I have ADHD, so this will come back. I might lose it for a while, but this will come back. So they don't feel like they have to torture themselves. Yeah, that's a very good start. I guess another thing is that if you want to, sometimes I tell my clients, if you want to go full steam ahead, okay, let's make sure your life accommodates that. Right? So like, oh, hyper focus. How about let's say it's Friday, Saturday, you're hyper focusing. You try to make sure Sunday you take time off.
Right, yeah. Right? Depends seasons instead.
Yeah. Or some of my clients, they'll say, oh, I know I have this project, and when they're really into this project, they know they're gonna hyper focus for that. So for that 1 week, right, they're gonna be like so they take leave. For the Monday, Tuesday after that, they plan a trip to the beach. Just work with your body, not against it. And what you mentioned just now about I suppose that's also where the tracking helps, because then you have a better idea, right? Like, okay, maybe this time I want to hyper focus. This is about how much energy I have based on past data. Yes, true.
This is how best I can handle it.
Yeah,
that's awesome. Yeah,
and it's a learning process. Sometimes it's like, oh, I'll go, and it happened again. When you're curled up in your bed, you cannot move. Then next time.
Next time, yeah.
This time will be different.
It's a very experimental process, right? What have you found have helped your clients be consistent in that journey? Because as you said, sometimes it's very experimental. There are days where you're not going to feel like it, or days that you have much more energy, much more motivation, right?
Yeah.
What helps them to stay on that path of going in that direction?
Well, what works is to have big habits and little habits, right? So once you figure out things that are good for you, everybody's different. Sometimes exercise or sleep or bubble baths. So when you feel a lot of energy, you do the big ones. You don't have to, but you can do the big ones. When you feel really, really down, you do 5-10 minutes of stretching. So you start to feel like, you know what, no matter what, there is some consistency in my life. I have control.
I love that, because I think that sometimes that so many people be like, oh, you should try to have more energy, take this supplement, whatever, all of that to make sure you have more energy. But I really think that it's more about being strategic about the energy that we have. So that's excellent advice. Great point. So we've discussed quite a few things today, but just to before we wrap up of it, is there anything else you also want to share with Ruzz, or some random insight you have about ADHD based on the things that we've discussed today? Let us know.
For Ruzz, I think you're going through a very hard time. Motherhood is not easy. ADHD is not easy. I don't know what else you could be dealing with that's not easy. So cut yourself some slack, just think about how to make your life as easy as possible. Stop torturing yourself.
Yes, yeah.
That's why I say to my clients all the time, stop torturing yourself. What is this for?
Yeah, but they feel that they need to, I think that's a very common denominator there.
To be fair, I say that to them, I also torture myself.
But that's where therapy also helps, because when you talk to someone else and then they're hearing it, they're like, okay, look, this is torture. It's qualified as torture. Maybe you like to take different decisions, right?
Yeah. Okay, yeah. So I think that's just a general theme of managing ADHD, but also managing a lot of other things. Stop torturing yourself, understand yourself, and try to work with what you have.
Whether that's meds or no meds. So we hope this episode was helpful for everyone there. Thank you so much, Lavender.
Thanks for having me.
We'll see if we do another one. Let us know if you've enjoyed this episode, if it was helpful. Ruzz, we hope it helped you, and we'll see you in the next one. Take care.